So we don't really have that many new tests for C. diff, but I think what our session here today was trying to discuss is to be more sensible about how we do our testing. We have this notion of antibiotic stewardship where we steward or guide people in their prescribing of antibiotics, but we can also steward people in the testing. So one of the issues basically is to make sure that we test the right patients, and that, for example, for C. diff, many patients can be colonized that could have the bacteria on them but not making them sick. And so if we tested someone who doesn't have the symptoms of C. diff, they may come up positive. It might force them to be isolated in their room by themselves or be treated unnecessarily. So really having criteria for which patients to be tested, making sure that they have diarrhea, that they're not retested if they don't need to be. That would put extra burden on the lab to do extra tests that are not needed. Making sure, for example, that we don't give a patient a laxative which would promote diarrhea and then have it tested and it might come up positive for C. diff and it might really be a falsely positive test. The other side of that would be making sure that we do timely testing, because a patient whose diagnosis is delayed is a patient where we don't have the opportunity to really give them the appropriate treatment, but they may unnecessarily be spreading C. diff to other patients in the environment. So I think the session was really about how do we be smarter about our testing in terms of choosing those patients and doing really timely testing.